Hello, good afternoon. My name is Mildred Malada Izuma. I'm a medical laboratory scientist from Ghana, presenting on behalf of Barugaba Omar from Uganda, Team Affirmative Group 5, on the topic Should African athletes be allowed to undergo genetic modifications to compete internationally? Next slide. Introduction. Advances in genomic science are transforming medicine, biotechnology, and human performance research. Technologies such as gene therapy, CRISPR-based editing, and molecular pathway modulation are increasingly capable of altering biological functions such as influence muscle growth, endurance, and metabolic efficiency. These technologies were originally developed for therapeutic purposes, including the treatment of genetic diseases such as muscular dystrophy, anemia, and metabolic disorders. As genomic medicine advances, a critical policy question emerges. Should athletes be permanently prohibited from accessing emerging genetic technologies, or should responsible ethical frameworks govern their potential use? This presentation supports the position that African athletes should be allowed to access regulated genomic technologies within ethical and scientific governance frameworks. Next slide. Genetic modification in athletes raises important ethical and scientific questions regarding fairness, safety, autonomy, and integrity of sports. However, global sport has always evolved alongside scientific innovation. Advances in sports medicine, nutrition science, biomechanics, and training technology have already transformed athletic performance. Therefore, the key policy issue is not whether science will influence sports, but how emerging technologies should be governed responsibly and equitably. A prohibition only approach risks include excluding African athletes from scientific innovation and may drive experimentation outside safe medical oversight. Constructive arguments. Number one, the therapy enhancement continuum. Modern biomedical technologies often exist along a continuum between therapy and enhancement. Examples include gene therapy targeting myostatin pathways affecting muscle development. B. Erythropoietin EPO pathway regulation influencing oxygen delivery. C. Metabolic pathway modifications affecting endurance and recovery. These technologies were initially developed to treat disease, yet may influence physical performance. Therefore, ethical governance should regulate this continuum rather than deny its existence. 2. Technology already shapes elite sports. Modern athletic performance is influenced by numerous technological interventions, including altitude simulation chambers, biomechanical analysis laboratories, sports genomics research, precision nutrition and recovery science. If technology already influences sports, ethical discussions must focus on governance and fairness rather than assuming a purely natural competitive environment. 3. Scientific equity and African participation. African athletes have historically excelled in endurance sports despite limited access to advanced sports science infrastructure. If genomic technologies become integrated into future sports science, excluding African athletes from this innovation risks reinforcing global scientific inequality. Allowing regulated access ensures equitable participation in innovation, African contribution to genomic research, scientific severity within global sports. Next slide, please. Okay. Rebuttal. Opponents argue that genetic modification would create unfair advantages and undermine the integrity of sport. However, sport has always incorporated technological innovation. Examples include: 1. Surgical innovations as enabling athletes to return to competition. 2. Advanced sports medicine therapies. 3. High performance training technologies. Fairness in sport is therefore is not defined by the absence of technology, but by transparent governance of technological advantages. 2. Safety concerns. Opponents often emphasize the potential health risks of genetic modification, while safety concerns are legitimate. Regulated research environments provide far greater protection than prohibition alone. Effective governance could include biomedical ethics review, strict medical supervision, international monitoring frameworks, long-term health surveillance of athletes. 3. Autonomy and cohesion. Concerns are often raised that athletes may feel pressure to undergo genetic modification. However, similar concerns exist in many areas of sports medicine and professional athletics. Ethical governance must therefore include informed consent procedures, anti-coercion policies, and inadequate athletic advocacy mechanisms. These safeguards help protect athletes' autonomy while ensuring safety. Closing statement. The future of sport will inevitably intersect with advances in genomics and biotechnology. Attempting to permanently prohibit emerging technologies may be unrealistic and could push experimentation outside responsible scientific oversight. Instead, the ethical challenge for global sport is to develop transparent, fair, and medically supervised governance frameworks that balance innovation, safety, and athlete protection. Allowing regulated participation ensures that African athletes remain part of global scientific progress rather than being excluded from it. Thank you.